Okay, B11.7, the artificial control of fertility. This is following on from my other topics talking about fertility that we've been through already. So to prevent pregnancy, you need to prevent the egg and the sperm meeting or a fertilised egg implanting in the uterus. So pregnancy happens when the sperm and egg meet together and form the embryo, or when the egg is implanted, the fertilised egg is implanted into the uterus. If this doesn't happen, pregnancy doesn't happen. So this is known as contraception. So I'm going to go through some different contraceptive types quickly, and then we'll explain the advantages and disadvantages of each. So the first one is hormone-based contraception. So we're going to look at oral contraceptive or the contraceptive pill. So a female uses this, and it uses female hormones to prevent pregnancy. The mixed pill contains low doses of estrogen along with some progesterone. We talked about what these two hormones do in the previous video. The hormones inhibits to stop the production and release of FSH, stopping eggs maturing. The pill hormones also stop the uterus lining developing, means there's less chance of implantation. They also make the mucus in the cervix, so the entry point into the uterus, so the mucus is thicker to prevent sperm getting through. So the advantage is that it's easy to use. Disadvantage are the slight risk of these side effects. So there's an increased risk of blood pressure, high blood pressure, even thrombosis of blood clots, and breast cancer. Some contraceptive pills contain progesterone only, and they have fewer side effects than the mixed pill that I've just described above. However, women must take it regularly for it to work. If they don't take it regularly, its effectivity will be reduced dramatically. So most women are on the contraceptive mixed pill. So I'm just going to look at the contraceptive patch. So like the mixed pill, it contains a mixture of estrogen and progesterone. You stick the patch to your skin and you need to replace it every 7 days, so you need to remember to do that, and the hormones are absorbed directly into the bloodstream. So all of these methods I've described so far prevent the egg maturing and being released, as well as affecting the line of the uterus and the mucus of the cervix. So all of those, the contraceptive patch, the implant and the pill, they all do these things that are highlighted. Talking on some different methods now. So there's the chemical method. So spermicides, they're readily available but not very effective at preventing pregnancy. Chemicals in spermicides kill or disable the sperm. So if the sperms can't swim or killed, they're not going to fertilise the egg, but it's not a very reliable method. Another common method is the condom. A condom is a thin latex sheath, so a cover that is placed over the penis during intercourse to collect the semen. And semen is the liquid produced during ejaculation containing the sperm, and if this is caught in the condom, it prevents the egg and the sperm meeting, therefore preventing fertilisation. So advantages: there are no side effects, and it also provides protection against sexually transmitted disease such as AIDS or syphilis or other STIs. And disadvantages is that the condom can get damaged and let sperm through. So if a condom has been kept in a place where it's been rubbed or in contact with something, it could cause holes into it, so they could get damaged quite easily. The next method I'm going to look at is the diaphragm. This is a thin rubber diaphragm, so like a dome or sort of cover, is placed over the cervix before sex to prevent the entry of sperm. Like condoms, they have no side effects but must be fitted by a doctor initially to make sure they're fitted correctly. If the cap is not positioned correctly, sperm may get past and reach the egg, therefore pregnancy may happen. So condom and diaphragm, they're both called barrier methods, and they work better when combined with the spermicides. The next one, intrauterine devices. So intrauterine devices are small structures inserted into the uterus by a doctor. They last for 3 to 5 years, although they can be removed at any time if you want to get pregnant. Some intrauterine devices contain copper and prevent early embryos implanting in the line of the uterus. So if the embryo is not implanted, it therefore cannot develop. Others contain progesterone, and you know what progesterone does from previous videos, and what it inhibits the release of. These methods are very effective but may cause period problems and infections. So even though they're really good at doing their job, they may cause infection and period problems. I've got a couple more to talk about. So abstinence. So if you don't have sex, you can't get pregnant, simple as that. Some religious groups do not accept the use of artificial methods of contraception. So artificial methods are all ones I've described already. Abstaining from intercourse around ovulation, so when the egg is released, may means sperm cannot fertilise the egg. So remember, an egg can be fertilised in the uterus and in the oviducts along the way. So not having sex when ovulations happen is called the rhythm method. It has no side effects, but it's very unreliable as it's difficult to tell when ovulation actually happens. And the last one I want to talk about is surgical methods. So vasectomy. So in men, vasectomy means the sperm ducts are cut and tied, so they're the tubes between the testes and the penis, preventing sperm getting into the semen. In women, the oviducts, of the tube between the ovaries and the uterus, are cut and tied to prevent the egg reaching the uterus and therefore the sperm reaching the egg. So although this offers effective permanent contraception with no risk of human error, so you're not going to forget to take the pill, forget to change your patch, women do need general anaesthetic for this surgery. I'm just going to show you a table with the overall effectiveness of each method. If you pause the video and have a quick look, you can see that. You can see that there's, so along the bottom of the proportion of women with unexpected pregnancies in the first year of use, so no method, around 85% of women had an unexpected pregnancy. And we can see that the IUD, so intrauterine devices, they're the most effective, followed by the patch and the pill. So less than 10% of people on the pill had an unexpected pregnancy in the first year of use.